Cardiovascular diseases occupy the first place in mortality among all other diseases. And the most unpleasant thing about this is that not doctors, not people, do not want to understand the cause of these diseases. The maximum they can say is that it's because of a wrong lifestyle, bad habits, poor nutrition, lack of mobility, and that's it. Yes, of course, they also prescribe medications that will relieve symptoms for a while the problem will worsen and increase. It turns out that they do not offer recovery, but only the removal of symptoms. We do not urge you to give up medications, we urge you to understand the problem and solve it once and for all. Problems with the cardiovascular system begin with the replenishment of the inner lining of the artery. The body understands that there is a problem inside the artery, and tries to eliminate it by all available methods. He does this at the expense of cholesterol, calcium, and protein. This is similar to sealing a hole in a pipe. As a result of this, the walls of the artery harden and the lumen of the artery becomes smaller. All this hinders blood flow. There is a risk that the blood clot will come off and lead to a heart attack or stroke. Of course, if we understand what causes exacerbations, then we will be able to prevent it. Yes, that's the way it is. Friends, subscribe to our channel if you haven't done it yet, and we will continue to try to make content about folk medicine for you, check it, and give it to you. In conditions when you need to pay for treatment, it can save you in a difficult moment. What causes inflammation of the arteries? The main two factors are the deficiency of vitamins and electrolytes. Let's talk about each one separately. The first is vitamins. The fact is that vitamins and electrolytes should be in strictly defined quantities. Therefore, most often, taking pills with vitamins, we do not get any effect. And in the worst case, the problem gets worse. Because nature has created products where all vitamins and trace elements are balanced, you just need to make sure that they are absorbed. Vitamin E protects our blood vessels from inflammation. And excessive amounts of sugars, refined oils cause inflammation. As soon as vitamin E has become scarce, we get replenished. Of course, you can eat foods where there is a lot of this vitamin. But here the question is digestibility. You can eat as much as you want and anything, but if there is no proper digestion, then everything will go wrong. I also want to focus on such a vitamin as K2. This vitamin does not allow calcium to enter the arteries, joints. On the contrary, it directs this calcium to where it belongs, to the bones. Calcium deposits in the arteries will make them brittle, blood flow will be obstructed and joints will be sedentary. The fact is that vitamin K2 synthesizes bacteria. There is a lot of it in fermented foods. It is synthesized by bacteria that live in our intestines. Therefore, proper digestion is the key point. And the correct digestion begins with gastric juice. The work of the gallbladder, liver, and intestines directly depends on gastric juice. But with age, the production of gastric juice drops and problems begin. This requires a clear balance of electrolytes. But when heart problems begin, the first thing doctors do is start a salt-free diet, where the two most important electrolytes, sodium and chlorine, are located. But the fact is that vitamin E is in fats and it cannot be absorbed without fat, since the vitamin itself is fat-soluble. We need salt, I have always said this and I say it. I am already 90 years old, I always take sea salt on the tip of a knife after eating, dissolve and swallow. You just need to understand that everything needs a measure. But it is impossible to completely abandon salt. All this is easily solved by normalization of digestion. By the way, most medications for hypertension and arrhythmia block some kind of electrolyte, thus solving one problem but causing many others. All electrolytes work correctly only when they are balanced. For example, the same arrhythmia can occur both with a shortage and with an excess of potassium and magnesium. And hypertension both with a shortage and with an excess of calcium. Therefore, I am always outraged by how drugs can be prescribed despite the content of electrolytes in the patient. Summing up, I will say that it is difficult to deceive nature. She invented the food that we ate it. But she didn't create pills. Simple food, balanced, it has the right amount of vitamins and electrolytes. I am sure that human health begins with a healthy digestion,